Arthroscopic removal of a large calcium deposit from the rotator cuff, presented by Snyder from the Southern California Orthopedic Institute. When a calcium deposit occurs within the rotator cuff tendon, it creates a large hump, which is like a boil on the skin. It's inflamed and tender, and it can be removed by viewing with the arthroscope into the bursa and cleaning out the calcium deposit with a shaver. Here we see an X-ray showing a large calcium deposit within the rotator cuff tendon. The MRI of the same patient shows how this black deposit is within the substance of the rotator cuff and will need to be removed. We begin by evaluating the entire shoulder. Here we're looking inside the glenohumeral joint or shoulder joint, and we see a red strawberry lesion on the undersurface of the rotator cuff. Notice how no calcium is visible from this view. In order to locate this area, we insert a small needle through the calcium deposit and place a piece of suture material inside the needle. Here you can see some calcium within the core of the needle, and then the suture material will serve to mark this spot when we look on the other side of the rotator cuff tendon. This is simply a location aid for us, and here as we look on the top of the rotator cuff, we see the marker suture, and we take the pin again and puncture through the covering of the bursa on top of the rotator cuff to allow the calcium to evacuate. You'll notice that the calcium is soft, much like soft cheese or yogurt, and as we puncture this, it starts to flow out of the puncture wounds. We then use a shaver that has suction attached, and as we shave off the bursal covering, the calcium deposit is unroofed. We try to capture as much calcium as possible inside the shaver because calcium does cause a significant inflammatory reaction in the surrounding bursal tissue, and it's best to remove all of it if possible. Here, as we visualize from a different location, the calcium can be seen much like dried paint covering the inside of this large ulcer. Now we've cleaned out all the calcium, but we see we've got a flap of rotator cuff tissue remaining. To keep this flap from catching and to allow it to heal better, we'll stitch it together using some absorbable sutures. Sometimes suture anchors are necessary as well, but usually not. Here is the so-called PDS suture. We pass it through both layers of tissue, retrieve it with a suture retriever, and then tie the sutures together with a sliding knot. We usually use 2 or 3 of these sutures, and in about 6 weeks the suture material will dissolve, leaving the rotator cuff healed. We then go around the bursa and remove all remaining calcium that we can see. This tape is produced at the Southern California Orthopedic Institute.